Hi, I'm Dr. Ahadian. I wanted to talk about trichotillomania or hair pulling. Trichotillomania is a condition in which the person who's suffering from that begins to pull their hair out. Either it could be seen in the pulling of the eyelids or pull their hair from their head, back of the head, and sides. And this problem is basically seen in disorders related with obsessive compulsive disorders. In an obsessive compulsive disorder, basically there are tensions that the patient feels and reacts to that tension by certain behaviors, certain mannerisms, certain using of language or certain type of a activity to ward off the thought that comes to mind and to decrease the tension that he or she is feeling. Now, the trichotillomania is not by itself a basic disorder, but it's the sign of some other kind of problems that basically has to be looked at. Mostly people who are suffering from trichotillomania or hair pulling have a tendency of obsessiveness and type of a becoming very much preoccupied with thoughts or ideas or behaviors, that this kind of like thoughts begin to cause tension, and then the tension has to be calmed down by pulling the hair, and then the problem continues on, which causes more tension and then more hair pulling. And then there have been cases that the patient pulls out all the hair and the eyelashes, and causes certain kind of like cosmetic problems. Now, to deal with this problem, first we have to find certain kind of aspects of genetic precondition, the nature and the biological precondition that the patient is prone. Now, every kind of situation or disorder that usually happens, according to my opinion, has a genetic background, susceptibility, sensitivity of the patient towards that kind of like disorder, and therefore in studying these cases of trichotillomania, one could look at the family history and find out that there are a lot of family history of obsessive disorders based on, you can set gambling, alcoholism, drug abuse, issues with regard to obsessive compulsive disorder and obsessive thoughts that has to be warded off by certain type of behavior. And then you can see major depressive disorder in this type of a background, which by further investigation and analysis, one could get to the root of the problem and see the obsessive compulsive precondition and sensitivity of that individual, which throughout the family tree and ancestors, you see a lot of disorders related with obsessive compulsive spectrum disorders, which exhibit itself with depression. Now, after evaluation and understanding of this background history and the relationship and the genetic precondition that causes susceptibility in this kind of disorder, we have to then look into the treatment of that. And then treatment of trichotillomania then basically is not just dealing with the hair pulling, but it's dealing with the whole spectrum of the situation of the patient, related to a family, related to a background, related to the genetic background of his or her side of the family, and then finding that out, and then dealing with the problems that has caused to get the person in that position. Basically, a lot of tension is going around that the person who's suffering from this disorder, a lot of issues with regard to anxiety provoking condition, a lot of stress related situations that are happening either in the parents of the person who is, if we are dealing with an adolescent or a young child, or around the situation with the family, either the father side or the mother side, the problems related to the family, which again by itself, if we look more analytically to that, there is a precondition of obsessive compulsive and obsessive type of inclination in the patient father side or mother side, and then the whole family are basically going through that kind of phase and very tense and stress related, which then transfers that to the patient, and then the patient exhibits with problems related with hair pulling. Now, the treatment modalities basically are psychotherapy and medication management. Psychotherapy basically to understand, to express, to achieve ability to know the person and to calm the person, to help the person who is suffering from this kind of situation to deal with the environment and accept him or herself the way they are, and then to reduce the stress and the pressure that they have, in order to then reduce the trichotillomania or hair pulling. The other aspect of biological intervention is mostly using medication. Medication based on some anti-anxiety medication could be used, but mostly the approved or the way that the mechanism of the action of the obsessive preoccupation and the serotonin theory based on using serotonin inhibitors, antidepressants with somehow higher doses to deal with the expression of this disorder, and to decrease the tension, which actually the serotonin reuptake inhibitors, if I said serotonin inhibitors, I meant serotonin reuptake inhibitor medication to deal with that condition, which is mostly of the antidepressants that are being used at present time, which is under care of a physician and to be evaluated after evaluation of the patient overall. Now, again, the most important thing that I would like to emphasize here is that the problem solving in psychiatry and finding a disorder is not just one-shot deal of looking at a person and saying you suffer from trichotillomania, then you get the medication. It's a much more complex issue related to the person who's suffering from a disorder and their relationship to their family, because we are coming from our family. So if we have a disorder and we have a tendency and we have a precondition, then it's very it's probably, and it's very possible to look at our background and see that, you know, our father's side, our mother's side, that they have all that susceptibility to the same condition that we somehow are expressing and exhibiting. Therefore, that's very important to have in mind. So it's not just like a strep throat and looking and saying, okay, we see the bug and then we give antibiotic and that's it. Every person has a certain way of expressing themselves due to their background and how they are coming to get to the point they are. So it's extremely important to look at the whole big picture. Again, thank you very much for your attention. Any questions, please you can comment or ask or call, and I'll talk to you soon.